Celiac disease is a problem some people have with foods that contain gluten. Gluten is a kind of protein found in foods like bread, crackers, and pasta. With celiac disease, your immune system attacks the gluten and harms your small intestine when you eat these kinds of foods.
That's the busiest part of the GI tract. We absorb almost everything on that very short segment of the small intestine. And the patient's own immune system attacks that part of the small bowel. And it can cause various deficiencies throughout the body.
Celiac disease makes it hard for your body to absorb nutrients that keep you healthy. The symptoms associated with celiac disease are difficult to pinpoint and may mimic those of a number of other ailments. A patient may also not experience any symptoms at all. Celiac disease is fairly common, and a blood test is the only way to know for sure if you have it.
It can be 1 in out of 300 to 1 in out of 150, almost 1%. And as you know, everybody knows that diabetes is very common. Diabetes is about 1% of the population. This disease is very close to the incidence of diabetes.
If you're diagnosed, treatment includes following a rigid diet.
They have to stay on very strict gluten-free diet. They have to avoid wheat, rye, and barley. These are the 3 main substances they have to avoid for the rest of their life.
There are many alternatives to gluten-containing items you can use in preparing meals, such as buckwheat flour, quinoa, or rice. Following a gluten-free diet can reduce the risk of developing lymphoma or cancer of the esophagus, which are slightly higher in celiac disease patients. I'm Kevin Ryan reporting for St. Luke's Health System.